It is now time to introduce our special guest. We're really delighted to have with us tonight Dr. Joel Kahn. Joel Kahn. He's a tremendous guy. Joel Kahn, MD, FACC of Detroit, Michigan, is a practicing cardiologist and a clinical professor of medicine at Wayne State University School of Medicine. He graduated Summa Cum Laude from the University of Michigan Medical School. He's also known as America's Healthy Heart Doc. Dr. Kahn has triple board certification in internal medicine, cardiovascular medicine, and interventional cardiology. He was the first physician in the world to certify in metabolic cardiology with A4M-MMI at the University of South Florida. Dr. Kahn has authored scores of publications in his field, including articles, book chapters, and monographs. He writes health articles and has 5 books in publication, including Your Whole Heart Solution, Dead Execs Don't Get Bonuses, and Plant-Based Solution. He has regular appearances on Dr. Phil, The Doctor's Show, Dr. Oz, Larry King Now, Joe Rogan Experience, and with Bassem Youssef. He has been awarded a Health Hero Award from Crane's Detroit Business. He owns 3 health restaurants in Detroit and Austin, Texas. You can find Dr. Kahn at drjoelkahn.com. Dr. Kahn's presentation tonight is entitled The End of Heart Disease 2020, an end for which many of us would be grateful. So please join me in welcoming Dr. Joel Kahn.
Thank you so much. Oh, this is fun. They don't do this in Pittsburgh. Yeah, maybe. Toledo, Detroit, they don't see this. Not even Atlanta, right, Dr. Simonoff? Well, thank you very much. Can you guys hear me okay? I have 3 microphones on me. The podium's rolling. I have East Coast brain because we got in last night with my lovely wife, Karen. I've only been in Hawaii once before. About 2 years ago, there was a very special cardiology meeting in Maui, and I literally flew in, spoke for 2 hours, ran the beach, took a shower, and went back on a plane and went home. So it's nice to be able to stay a little bit today. I will say, so I don't forget, Dr. Michael Greger, I know you've heard it now several times, is coming next month. Pretty much everybody in the world knows who Dr. Greger is. He was in Detroit, my hometown, about 10 days ago, giving the speech that you'll hear. It's a brand new talk for him. It's always refreshing. If you've seen him before or seen a YouTube to get a new talk, it's a wonderful talk. Don't miss it. He's obviously very intelligent and very funny, but the material is very useful. And then the month after is Dr. Kim Williams. Dr. Kim Williams, I have very close friends for 30 years. I could tell you a lot about him. Don't miss it. Very academic cardiologist with a really good heart, and if you listen carefully, a really good sense of humor. He's been the president of the American College of Cardiology, which is as big as it gets in our field, and to do that plant-based and end up on the cover of the New York Times is a big deal. So I'm doing my promotional work for BSH, but it's because these are close friends of mine. And we're going to dive in. This is also a freshish talk for me. I added a bunch of personal slides and comments since I don't know many of you. In fact, I know my wife mainly here in the room, and that's for a very long time. But anyways, I am a cardiologist actively still, so is Dr. Kim Williams, so you'll hear from him too. And it's a very important role. We do have a guest cardiologist from Atlanta that saw the flyer eating at a restaurant here. He's here on vacation with his family. That's pretty special to come to a lecture on your family vacation. At any rate, we really have a problem with young people, middle-aged people, elderly people, heart attacks, strokes, congestive heart failure, and other manifestations of heart disease. And we start off perfect. I mean, just perfect. These gorgeous pipes. And you probably don't look at pictures of arteries very often, but we are born with just gorgeous pipes so the blood can get anywhere as much as we need no matter what's going on. And again, even though I've been practicing, I have been, this is my 30th year seeing patients after a lot of years of training. I'm always struck by the beauty. 50,000 miles of arteries. If you know how many miles are around the earth, it's about 24,000. 50,000 miles of arteries in your body, that's twice around the earth. Don't think about it, take it for granted, reach for another French fry, have another milkshake. We don't think about it. These things are just awesome. And this is a procedure that I did many thousands of times, a heart catheterization or a heart angiogram. And I mean, it's just gorgeous network we're provided with. And we mess it up so badly, largely, as we'll talk, due to choices we make in a rush, without knowledge, due to food addiction. Some of it's genetics, but I am always still struck how perfectly plumbed we are. And then it all goes to rot by a rather young age. It doesn't need to, though. This is an example, and let's see if there is a pointer. How lovely you do. Everything great here in Hawaii. But that beautiful artery we saw before is reduced down to just a little spot. So all the blood that used to be able to go through the big pipe now has to go through just a little space. We've got fat here, we've got hard stuff called calcium, we've got scar tissue, we've got white blood cells, but the bottom line is you climb stairs with that little space, you're short of breath, maybe you feel an uncomfortable feeling in your chest, and unfortunately one day you're yelling at somebody, or you eat a fatty meal, or you have a recent flu, and a little blood clot forms there, and then it's all closed, and you're really in a very bad place. This is another example of that previously gorgeous human clean artery down to just a little slit, and that's what we're dealing with. We're dealing with 35-year-olds having heart attacks, and 45-year-olds, and it seems the data is it's happening at a younger age. So we're going to talk about a whole spectrum of how to improve your health, very practical tips, science-based tips, and why this all happens. So some of you will recognize causes of death in the United States. Everybody in the room probably would raise their hand if I quizzed you what's number 1, heart disease, what's number 2, cancer. Some states these are flipping back and forth, but nonetheless, they're still very important problems. This lists chronic lung disease as number 3. But I'll ask you, if you're good students of Dr. Michael Greger's video, do you know what the real third most frequent cause of death in the United States is?
Diabetes?
Yeah, it's accidental and unfortunate hospital deaths, actually. And that is not a rabble-rouser statement. That was Johns Hopkins University publishing 4 years ago, that about 400,000, so you can see how that number would be right there, people in the United States, maybe a allergy to a medicine, a blood transfusion, wrong surgery, and mainly infection. So I really tell people, take exceptional care of yourself so you don't end up in a hospital. Because I mean, I've worked in a hospital for decades and decades, but it's a very complex environment of people handing off care to other people, and people overtaxed by responsibility. There's a movement at one of my hospitals in Detroit to cut back the number of anesthesiologists supervising people in operating rooms. I mean, it's just, it's not going to help that 400,000 number, although there is some recent data the number has dropped. So, but I want to talk to you a little bit about how I became a heart doctor and why I'm here today. So I don't even think my wife has ever seen that. That's my birth announcement. You can write it down and remember next May 19th, send me a card, please. Invite me back. That is my pediatric cardiologist. Why did I have one? Because somebody heard a little noise, you know the word murmur, and around age 9 months I had a little catheterization which proved to be a very innocent, tiny little thing. It all healed up. But I became a cardiologist because from my very first months I was seeing that very nice man named Dr. Green. I want you to notice his right hand, no problem. What do you see in his left hand? Yeah, he's smoking at the bedside. That's about 1961, because doctors were doing tobacco ads in 1961. It was about 4 years later that we got our first federal government announcement that there might be a connection between smoking. But I became a cardiologist even though there were other competing interests. That is my bar mitzvah picture, and what does it say? I was chubby. I wasn't like, you know, not too many of us were really obese at that time. But I don't know why, but I still have a few extra pounds here and there that I deal with now and then, but it started back then. I won't look around the room, but I think it's an important topic that not everybody who's 100% plant-based, and I'll tell you in a minute how I got there in a second, is absolutely rail thin. It's not about fat shaming or thin shaming. It's just there is data that you're less likely to develop certain diseases with a thinner body, you know, habitus. And certainly we spend billions of dollars a year trying to lose weight with books and tapes and diets and the rest. Anyways, that's where it started. I found that nice little girl in 5th grade, and we started dating in 11th grade, and we got married young in life. I was in the middle of medical school. She had just finished nursing school at University of Michigan. She's over there. But something funny happened because we went up to University of Michigan together, 1977. Few people in the room weren't born in 1977, I know that for sure. Is that we grew up keeping dietary laws called kosher. We walked into the dorm together and we said salad bar. That looked like the only thing that was going to work. Wasn't a big deal actually, but it was a nice salad bar. And that is the last time we ate meat, 1977, because University of Michigan had the worst cafeteria food over there and this beautiful salad bar over there. And that has, you know, been an unusual part of my experience. Is every day I've been training to be a doctor and to be a cardiologist in practice has been an animal-free day. It was a very, very fortunate turn in my life, because at age almost 61, there are no prescriptions in my body, and there are no surgeries in my body, and there are no doctor visits, except for the routine things I do, because I do keep up to date. And I don't think that would have happened if I would have gone for that gray burger and that, you know, lifeless piece of roast beef that my friends were eating in med school and worse. So that I adopted. I just don't eat anything that does that. And it worked out well, and I think it can work out. You know, people say this is a nutritionally deficient diet, and we've never really had a culture that's eaten this way for very long. Well, I'm 43 years, and we have the British Vegan Society that goes back 76 years, and somebody in the room can outdo 43 years, whatever the number is. I think we can get along pretty well with very little precaution. Now, I'll tell you, I said 1977 is when I went up to Ann Arbor, undergrad med school. My wife entered nursing school. 40 years later, I gave a lecture to the Dietetics Association of Michigan. 1,000 dietitians in a massive room in Lansing, Michigan. I talked just a little bit about myself, then I gave a lecture. This man comes up to me and he goes, "You owe me a thank you." I said, "Why do I owe you a thank you?" He goes, "I was the food director in your dorm in 1977. And he goes, I had no money to feed you guys. You made a very good decision, because that wasn't even beef you could eat that the other kids were eating." So my buddy taught me the power of broccoli and romaine very early in life, and it just was an absolutely funny thing. So the last little piece of it, that lovely lady is my 87-year-old mother, who I visited last weekend in Boca Raton, Florida. I talked to her several times today. But right about when my wife Karen and I were undergraduates in Ann Arbor and eating our simple little salad bars, my parents, which would mean my dad, got dragged by the collar, went to the Pritikin Center at that point in Santa Monica. Some of their friends had gone. And my mother's inclination was to cook healthy, but it was not vegetarian vegan. It was traditional cooking. At any rate, when we came home, also there was lentil loaf around. So the whole thing just said, be a plant-based cardiologist. It worked out, the stars were aligned. So a little fun walking you through all of that. I did manage, that's me right there with that dapper mustache. Clyde Yancey was the president of the American Heart Association, my buddy. Dr. Popma, Dr. Carey, Jim Willerson, one of the icons of cardiology. But it was very challenging to eat without animals in a city where there's stockyards everywhere. It's easier now, we made it. There was lots of sausage egg McMuffins. I'd like to tell you that's when I was a cardiology fellow, but that's this week in my hospital. They still feed cardiology trainees sausage egg McMuffins. We got room to go. This is how most cardiologists learn and get their nutrition. I am on staff at 2 hospitals in Detroit. One is a university hospital called Harper University Hospital. The first thing, no kidding, when you walk in the lobby is the Wendy's. You see it before registration on the right, before patient elevators on the left is the Wendy's. Absolutely abysmal. And the other hospital had to compete, called Beaumont Hospital, internationally famous. And they had to put in a burger joint called Wahlburgers, because Mark Wahlberg is sexy and hunky. And it generates a lot of media, but it's absolutely evil. Some of you may know this was the Cleveland Clinic, McDonald's, but it's probably now 4 to 5 years ago they finally got the moxie to break the contract and remove it. So it's still not, there are very few hospitals that you can actually say are healthy. It's a pet peeve of mine. I did along the way have this professor in Dallas, the most prominent cardiovascular pathologist in the world, who would say this is actually in 86 or 89, we kill the cows and the cows kill us. And he had a whole lecture, even back then, about how humans are much more like rabbits than we are like wolves in terms of our makeup and physiology. So it wasn't always that. There was zero data, and I was already crying. Here I am again in the year 1990. I'm now a stent maniac. I mean, you got a heart attack, I got a balloon for you. And I was simply eating my salads and my lentil loaves and my bean soups, always ready with my beeper to go off to go take care of somebody's totally blocked heart arteries. That is my mentor, Dr. Jeffrey Hartzler, who was at the time the most famous cath lab doctor in the world, and pleasure to work with him. So I was doing this badass stuff, and I started to step out into the public a little bit, because I'm telling you, your organization is 30 years old. We have a similar organization called Bench Michigan that just celebrated its 20th anniversary. You're older and more esteemed and proud of all you do. But they couldn't find another doctor 20 years ago that would really join. It was very interesting. We used to go to a little elementary school and have an annual educational symposium. We were glad to do it once a year. You're doing it once a month. And sometimes I'd walk in a little elementary school room and there was a doctor over there. What's your name? Caldwell Esselstyn, you know, with 12 people in the room. This is before Ruth was in Forks Over Knives, or anybody even thought of Forks Over Knives. So they put me out there as a ambassador of plant life, and it was a wonderful thing, and started lecturing more and more. I started leaving little notes in the hospital cafeteria. Process, so it says right there, what's the name of the person that should eat this? No one. Yeah, eat the berries. They didn't like that. They still don't like the whole thing. Yeah. And along the way, and I'm going to get to the science right now, but my son Daniel, my wife Karen, and I have actually been involved in 3 restaurants. As you heard, one is a food truck in Austin that's totally vegan. We were able to gift it and sell it to 2 wonderful vegan chefs that are doing an amazing job in Austin. And we've got a large and a small restaurant, and sometime I'll come back and talk to you for a few hours about the restaurant business. But you know, it was not to make money. If you've been in the restaurant business, you know the odds of making money is pretty much like Vegas. It was to provide whole food, plant-based meals in an elegant setting, and we've been working very hard at that for about the last 4 to 5 years. I started to do some fun stuff. Probably the first big time one was spending time with Rich Roll on his podcast. That's the Doctor Show, if any of you watch that. That's my buddy. It took me 20 years to meet this guy, but finally did meet him other than that brief elementary school. Recently, we've been campaigning across the United States, asking the president to become vegan and endorsing a January vegan effort. As Dr. Oz, he's not vegan. I like him. He's a pretty good guy. You know who that is, Larry King with the suspenders. And most of you don't know who Bassem Youssef is. Do you? Anybody know? He's a cardiac surgeon from Cairo who in 2010, while he was operating on patients, and there was an Arab uprising, the Arab Spring. He said, I want to be Jon Stewart. Jon Stewart, funny and political. And that's exactly what Bassem Youssef sounds like, not making fun. And he took his smartphone and he started making little short YouTubes. And within a few months, there were 50 million people following his YouTubes, because nobody in the Arab world speaks out about politics and the government. Long story short, he went to LA and got on the Jon Stewart show. Jon Stewart came to Cairo, got on his show. He's an amazing personality. And in 2014, they kicked him out of Egypt, just like me, the nudnik, leaving little messages, don't eat the bacon. He was a little bit more of an irritant. And along the way, he became vegan. So he is now the most famous vegan advocate in the Arab world, and he can reach millions of people. And I've been on a show with him, and he makes YouTubes in Arabic that get watched extensively, just in case you don't know him. All right, nutrition science, fun stuff. Do we know for sure that everybody in the world will be healthy till they're 120 by eating plants and not touching animal foods, and it's all perfect and you don't even need to see a doctor? We don't know that, okay? I mean, anybody oversells us, we don't know that. What we do know, because nutrition science, if you follow any of the ugliness and debates and conversation, Joe Rogan, if you're a fan of Joe Rogan, I've been on this show about 15 months ago for 4 hours, and very widely watched. It's a difficult science. This is the work of a Dr. Walter Longo, University of Southern California. If you want to eat for a good, long, healthy life, it requires looking at all the data from basic science. You know, what happens to a colon cell if you put it in medium with bacon-like substances, or you put it in medium with broccoli-like substances, and there are studies that have been done like that, and it strongly favors the idea that eating plants is very protective to our immune system, to our cardiovascular system. Basic science. There is no basic science that suggests increasing meat in the diet will protect your cells from becoming cancerous or promoting of atherosclerosis. The bulk of it is this very controversial topic, like even the Adventist Health Study, you're familiar. Okay, the Adventist Health Study wasn't, let's take people in Loma Linda, some of you guys for the next 50 years eat vegan, some of you guys for the next 50 years eat vegetarian, some of you eat omnivorish, whatever that is, general American food. Of course not. You can't do that for a large number of people for years and years. You ask questionnaires, you see who's healthy as time goes by, you try and use statistics, and you try and come up with honest answers. That's the bulk of nutrition science. There are now an increasing number of people who say, throw that all away. It's all garbage, even though we've had literally thousands of studies like that. And much of our scientific platform to say whole food, plant-based diets prevent and can reverse disease, our epidemiology. Clinical studies, God bless, we get more and more every year than we've ever had. Centenarians studying the super old, finding that they usually don't eat large amounts of meat and large amounts of dairy and large amounts of poultry. They tend to be largely plant-strong eaters like Okinawa, Loma Linda. And then looking at the whole big picture, this refers to the fact, what diet has an impact on the environment? What does a diet have an impact on animals and such factors? And when you go through this whole process, and we're not going to go through it pillar by pillar tonight, but I want to move into heart disease right now, you do come up with the conclusion that we have the bulk of the data. It may not be a perfect argument, but we have the bulk of the data. I spent this morning, we were in the gym at the hotel. There's a debate about a year ago between Dr. David Katz, some of you may know him, very prominent lecturer, and a couple of hands waving, David Katz, and an evil woman named Nina Teicholz, who wrote a book called Big Fat Surprise in 2014, How Meat and Cheese and Butter is Really Good for You. Well, that may seem like a silly book, but the book was given awards by almost every book publication society and medical societies as being a breakthrough book. It's crazy. And there's still some people that are totally lost in her pitch and all. This debate was lovely, and Dr. Katz went through these things as nobody else can. He's just a premier presenter, and he won the debate easily and handily and all. All right, an impossible to read study, but what I want to point out is very interesting. About 3 years ago, I went to San Diego to a very special medical clinic just to go through an experience where you had your whole genetic material analyzed. Interesting thing, and this was hanging on the chief medical officer's wall. What determines health? Right here, I said already, we got Dr. Simonoff's a cardiologist, I'm a cardiologist. 11% of health, your chance of being free of medication, free of surgery, feeling good in the morning when you wake up, 11% is due to medical care. This is research estimates, but this is felt to be very valid. The largest chunk of how you feel and what medication and how long and how well you might live is actually individual choices you make. Individual choices, you know what those are, right? Because we hear them over and over. And thank goodness, don't smoke, get fitness, eat well. In this case, we're talking about eating plant well. Some other things that are there, though, is about a quarter of it is social circumstances. Are there sidewalks? Is it safe? What's the air like? Do you have friends that are healthy? Things like that. Genetics, about 20%. And more, just to let you know, you live in this gorgeous haven of Hawaii, but certainly in LA and New Delhi, air pollution would be an example. The amount of science that is now linking air pollution, something that's your physical environment up there, 7%, you don't have much control over necessarily, except if you cook inside your house with wood and fire, like 1 billion people in the world, you can control that, I guess, by cooking outside. But nonetheless, that matters. But individual behavior, so let's talk about that a little bit. And back around the year 2000, there was some breakthrough data, even though we already said cancer, heart disease, stroke, lung disease are the cause of death. A reanalysis said that 80 to 85% of the deaths were actually caused by modifiable behaviors, just like that chart before. Do you smoke? What do you eat? And do you move? And that, in fact, if we want to delay death and improve health, we need to teach and focus on these very obvious lifestyle factors: tobacco, poor diet, and physical inactivity. Some people call that feet, fingers, fork. Feet, do you walk? Do you move? Are you active? Fingers, do you smoke? Fork, do you intelligently put your fork into a bowl of beans and salad? Or do you unintelligently eat one of those sausage egg McMuffins at a cardiology conference? So this idea that we really do have control over death rates, even though we're not doing so amazing in the United States the last few years, came through. All right, so that was all a little background on me, a little background on why I'm very optimistic we can promote health throughout this chain of islands, the United States in general, and the world. But I want to first start. You won't enjoy the future if you die of heart disease in 2020. I think you can all agree. It's not going to be a great year. Of course, I'm talking globally, not about anybody in this room. And in the 1600s, this very well-known physician, Thomas Sidingham, the few medical people in the room will recognize the word Sidingham's chorea, a sign of rheumatic heart disease and such. He said you're as old as your arteries. Now, there were no CAT scanners, there were no cath labs, there were no echo machines. I presume he knew that from autopsies. You're as old as your arteries. So I'm going to dive in for a couple minutes, a cardiology topic, not a broccoli topic. Talk about how you can find out how old your arteries are. Because if you want to have a really good decade ahead, you can't die of heart disease in 2020. I think you'll agree. And unfortunately, it's that common. And in my practice, I have a very advanced cardiology preventive practice. It's not a simple equation. Forks, fingers, and feet are the big three. But this is a very scary picture of an artery to the heart with all these daggers. Some of them are your cholesterol levels, your insulin levels. Some of them are genetic things you inherit, like homocysteine. It's really very complex. And what we're usually doing is depending maybe on a doctor, nurse practitioner, physician assistant. They check your blood pressure, do a couple simple labs, ask you a few questions, and say, there's no signs of heart disease. I'm suggesting to you that's not enough in 2020. You can do a little better. And even if you don't have every one of these things checked, even though in my clinic I have these things checked in every patient and many, many more, even if you don't, I'm still going to tell you how you get right to it. For example, if you look right up here, there is a kind of cholesterol called lipoprotein A. So you've never heard of it, probably, maybe a few of you have. 1 out of every 4 persons inherits lipoprotein A. It's actually called lipoprotein little a, just to confuse it more, because you can't put a capital A there, it won't be correct. 1 out of every 4 persons inherits that. So from the day you're born and your entire life, it is potentially causing your arteries to get clogged and clogged and clogged, and it actually affects, it's called your aortic valve, and it's a very common cause of aortic valve disease. 1 out of every 4 people. How many of you in the room, don't raise your hand, have ever heard of it and had yours checked? Probably not. In Europe, they're starting to recommend it. We discovered this in 1963, so it's not brand new, and there's hundreds, if not thousands, of papers. This happens to be, you might notice my name there, a book I have coming out in March. It's the first book by a medical doctor in the world on this topic, I'm proud to say. And if you don't want to read about the disease, you can still enjoy the 50 plant-based recipes that Beverly Lynn Bennett put in at the end, because we still are struggling to come up with the best treatment plan for people that have a high level. But we know that taking good care of yourself, and you know in this room taking good care of yourself, is whole food plant eating. And you need a few recipes to successfully do whole food plant eating, and you need whole food plant recipes. So that is one example. So going back to that topic, you've been to your doctor. I want you not to have a heart attack this year or this decade. How good are we in the medical world when we got Winston Churchill making it to 91, looking, my God, like a guy that would have been in an obituary in his 40s or 50s. And some of you remember Jim Fixx and a whole lot of other people that have dropped dead in their 40s and 50s despite lean bodies and athletic endeavors, because it's a complex equation. So do you say it's too complex, I can't figure it out? No. You take technology and behavior. So first of all, don't have a heart attack in 2020. We know there are certain lifestyle factors that dramatically reduce it. I still don't think this is good enough, but let's go through them. Don't smoke, walk every day, eat a lot of fruit and vegetables, sleep well. You know, we don't talk about sleep as much as we should, though we're talking about it more in medicine than we ever did. And strangely, and please don't start drinking if you don't, but these are studies, these are research, these are studies involving about 40,000 people in Europe. A little bit of alcohol during the week is protective for heart attack risk. That has shown up over and over and over. It showed up last week in Harvard studies that are, you know, about 5 years newer than this data. So number one, lead a really healthy lifestyle. It's still not enough. Jim Fixx seemed to be leading a real healthy lifestyle. How do you really know? This is a picture called an angiogram. This is how we go inside and inject dye into the heart arteries. And that arrow is pointing to what we affectionately call the widowmaker, because if it goes from 90% to 100% blocked, there's a decent chance somebody might not make it to call 911 and get to the hospital. How do you know for sure? So that in 2020 and the rest of the decade, you don't suffer the consequences of this. So I'm going to show you 3 things real quick. I am going to talk about broccoli, don't worry. Number one, in the 1970s, a physician in New York named Dr. Frank wrote an article in a very prominent medical journal called New England Journal of Medicine. If you have a deep crease in your earlobe, and nobody can look right or left, it's not fair. You can take your compact mirror out if you want to look, but you can't do it on the. If you have a deep crease in your earlobe, it's about 70% accurate that you may have clogged arteries. There actually is a theory why this is the case, and I am maybe the only cardiologist in the United States when I ask a patient, so why are you here today? My wife noticed, my husband noticed I've got a deep earlobe crease. What are we going to do to check it out? 70% is not 100%, so there's no reason to get too concerned, but it is about as accurate, and there are, in the last decade, multiple studies confirming it's accurate. It's about as accurate as doing a stress test on somebody at age 50, for example. I'm sure nobody in this room, but about 50% of men by age 50 have problems with sexual performance. And unfortunately, the answer is, here's your generic Viagra, because now it's not $10 a pill, it's 10 cents a pill, without the question being, I wonder why this 50-year-old or 40-year-old or 60-year-old has the problem. Sometimes it is a clue that arteries are clogged. If you've heard Dr. Esselstyn talk, you'll already be aware of that. We sometimes call it the canary in the coal mine, an early warning system. So I will see guys and I will give them the prescriptions to help their quality of life, but they have to have complete heart testing, because I do not want them dropping dead in bed or anywhere else in 2020. There are ways, however, and this is really what I want to hit home, and I want you to write this down in a minute, to really know in detail. That's a CAT scan machine, these are ultrasounds, advanced blood testing. But this is what I want you to know about, because even though it's not a plant-based topic, you can enjoy all the benefits of plant-based life if you already have some heart disease that could trigger a problem in 2020. So you can go to a hospital. In my neighborhood, it's $75 to $100 cash. Rarely will insurance pay. If I just back up for a minute, CAT scan, go in there, hold your breath, 15 seconds, you're done. The test is called the coronary artery calcium score. But doctor, I don't have any symptoms. I feel fine. Yeah, I know my cholesterol's 220. I guess that's kind of average in America. And my blood pressure is 134 over 84. And 84 is a little high, but I'm fine. Well, in about 10 seconds, panel A, you can actually see heart arteries. This is a direct way to know for sure. You're more like Winston Churchill inside than you are like Jim Fix. Perfectly wonderful. These little white spots are calcium. There's a rib right there. Ribs are supposed to be calcified. Teeth are calcified. Your heart arteries should not be calcified. These people don't have any symptoms. They're playing squash, they're planning trips, they're scuba diving. You would not want to do that necessarily with this massive amount of silent aging and damaged arteries without more investigation. $75 to $100, 10 seconds. Strongly consider getting that done in your life around age 45, 50. Now, that used to be somewhat of a outside the norm recommendation. I got involved in these scans about 25 years ago. I didn't own the machine. It's not a sales pitch. Usually it's a hospital has these CAT scanners. They're big, expensive machines. But I've been around thousands and thousands and thousands of people, and you can make a difference. If nothing else, start eating better, exercising, don't smoke, get your labs done. I will tell you though, I know this is unreadable. This is what we call the American College of Cardiology. This is 2019. Dr. Kim Williams was president of the American College of Cardiology. And those really small print down here, finally, 25 years later, they say, consider measuring that coronary artery calcium score so you find out if you have a problem and if you need to take medication. Or I like it the other way. If you don't have heart disease, then you don't need medication. Just keep eating healthy and working with your doctor. So this is no longer a small but aggressive group of preventive docs, of which I was one. It's now becoming more and more the mainstream. However, it does usually require a prescription, and your family doctor, your internist may not yet be very experienced, although it's 20 plus years later. There's a really great documentary on Netflix called The Widowmaker movie. It's fascinating, it's worth watching, and maybe passing that knowledge on to your own medical team so they can watch it too. There's another way to do this by ultrasound. There are some people, the amount of radiation on that CAT scan is really tiny, but yet it's nice that there's an alternative. You can look at the neck, you can get some really, really accurate ultrasound pictures of the neck and determine that same concept. Your person is as old as your arteries, doing it with ultrasound. This is an example. This is the right carotid artery up to the brain, no plaque. Left carotid artery up to the brain, no plaque. It actually says here it's a 60-year-old person with arteries like somebody 9 years younger. Would you like arteries 9 years younger than your driver's license? I mean, my patients would. Well, it happens to be, I'm proud to say, my scan. And after eating plants for 43 years, I have like nobody in my practice with a scan like this. And I don't read them. These are read at the University of Utah. So, I mean, that's not an advertisement, but it helps me make the case that there's something to this plant-based eating if you start early enough and sustain it long enough, and do a few other things, of course, like don't smoke and be fit and get sleep and manage stress and all the other things that try and do today to be healthy. All right, so we talked about how important heart disease is. We talked about you can detect it early so you don't succumb to it. But why do you want to know if there's nothing you can do about it? And many of you have seen and are most familiar, I would imagine, with the work of Dr. Caldwell Esselstyn. God bless him, great friend, great hero of mine. But I want to go through, even beyond that, a little more data than maybe you've seen before. Because there actually is a whole series of people that have been involved with identifying that diet and heart disease is a connection, and changing your diet can get rid of heart disease as an option. So I won't ask how many of you know who Ancel Keys is. He's neither vegan, and he's not a cardiologist, and he's not even alive anymore, but he was a double PhD who started studying nutrition, which is what the topic of, this is the Vegetarian Society of Hawaii. It's a nutrition talk. That's Dr. Ancel Keys in Italy in about 1956. That's Paul Dudley White. He was chief of cardiology at Harvard. He was President Eisenhower's cardiologist. He wrote the textbook most cardiologists use for more than a decade. And they're discussing research in these small little towns. Can we figure out why people get heart disease, and can we do something about it? Ancel Keys got beat up over the years as somebody who manipulated the government so that we changed the guidelines to lower the amount of fat in the American diet. It didn't work. It's sugar. Dean Ornish is all wrong. I will say I kind of took him on as an orphan case about 3-4 years ago, and I've written his biography a number of times, and it actually has turned the tide, and he's getting the recognition which he used to have. He lived to age 100.5, so that's either good luck or he figured out something about nutrition and health along the way. In fact, a lot of his colleagues have lived to almost 100. One right now, Dr. Henry Blackburn, MD, University of Minnesota, is about 95 and still plays in a jazz band. These are all guys that went to Italy and other Mediterranean countries in the 50s and 60s and figured out healthy eating mattered. Bacon wasn't doing it in Italy. And they figured out, and you may have seen something like this in the Game Changers, when you have a beautiful bowl of arugula with tomatoes and with pears, like my wife and I did for lunch today. If we took a sample of our blood and spun it down, it's crystal clear motor oil. That's called your plasma, because it's naturally low in fat and very healthy. And if you look at the blood of an average American after that sausage egg McMuffin at a cardiology conference, that's what's scary to me. Your loved one's about to get a stent to their heart by somebody who's trained and just ate breakfast at a conference, and their blood is just like sludge. And this was the research in part of Dr. Ancel Keys. He did a very famous study called the 7-Country Study from 1958 through 1970, but then they kept on following this. And this was the data that changed a lot of American guidelines. The higher the intake in your diet of saturated fat, the higher was the risk over 25 years that you're going to die of heart disease, predominantly heart attack. The higher the amount of saturated fat in your diet. If you look at this, although they didn't draw a line here, if you know statistics, that's a very strong relationship. Countries like Japan that had very low saturated fat intake had very low heart disease death rates. This is Finland, North Karelia, Finland, the highest saturated fat intake in 1968, 70, 71, 72. They had the highest death rates. Very strong data. We didn't know that. Dr. Ancel Keys did the nutritional epidemiology. Now we could throw that out. I wouldn't throw it out. I believe it. He also looked at if your blood cholesterol relates to your risk of dying. And you can see here in Japan, they traditionally have a low blood cholesterol and a low risk of dying over 25 years follow-up. There's our friend Finland again. Average cholesterol well over 300. Risk of dying over 25 years very high, although Finland has made tremendous changes to bring down their saturated fat content and their blood cholesterol content. So we learn these things, and the last thing we learned from Dr. Ancel Keys, has anybody here ever heard of the Nihon-san study? You guys might, because it's about you in Hawaii. This was a group of people that looked at health parameters in men in Japan. Then they monitored health parameters of men who had moved from Japan to Hawaii. And finally, they monitored the health parameters of Japanese men who had moved to Hawaii and then ended up in California. And what did that all mean? Because there was a traditional diet in Japan, and here we are in Hawaii where it's a mixture of cultures with some people, from the mainland that opened restaurants that were unlike anything ever seen. And then California, it's free for all. So very interestingly showed that the Japanese that stayed in Japan had very low cholesterol levels and very low heart disease rates. Once they moved to Hawaii, their cholesterol went up and their heart disease rates went up. And once they made it to San Francisco, they became full blue-blooded Americans, except it wasn't blue-blooded, it was sludge-blooded. So when you actually look at this, Japan is in white, Hawaii is in black, and California is in stripes. These are rates of dying of heart disease, and you can see very low in Japan, medium in Hawaii, very high in California. Interesting data, and this is often used to make the point, genetics matter, but your genetics don't change in one generation. These are people that move within 20, 30 years. So I just wanted to point out all that because you've never heard of Ansel Keys. You've probably never heard of Lester Morrison. Lester Morrison knew the data I just showed you. He was an internist in Los Angeles, practicing near Cedars-Sinai Hospital. He had a lot of heart patients in 1947, 48, 49. That's when we really saw a lot of heart attacks. Post-World War II, people came back smoking, people came back, it's a great place to live in America, kissing the girls in the middle of the street like the famous picture, and they started eating meat and cheese and butter, the economy picked up. Dr. Morrison didn't know what to do with all his heart patients, but by studying some of the data from Ansel Keys and others, he created this diet in 1948. You've never seen this. Don't eat olives, nuts, avocados, cut back on oils, don't eat egg yolks and creams, cut back on processed white flour foods that are often very rich in fats, get rid of whole milk and cheeses and glandular organs and such. And he gave this diet sheet to half the patients in his practice, and he let the other half keep going. That's called a randomized clinical trial in heart patients of diet. He published the data, that's 1951, American Heart Journal is a very respected journal, and he published it over and over. He noticed their cholesterol dropped from 312 to 220. Their weight dropped, but look at the weights. The men weighed 166, and they went down to 145. It was a different era when the average weight of men was 166, that's long gone. Nonetheless, he was very optimistic that clinically these people were doing well, losing weight, feeling good, improving their exercise by following his diet sheet. But look what the heck happened in 12 years. Nobody following the standard California diet in Los Angeles was still alive, and half the people that followed that little sheet were still alive. So again, profound data. Now, you could criticize nutritional epidemiology. Maybe the people that followed the sheet also joined the gym and also quit smoking and also started meditating. It wasn't the case. This isn't a Dean Ornish study. This was purely diet. If you go to Cedars-Sinai Hospital, the cardiology auditorium is called the Lester Morrison Auditorium, but when I asked the question, none of the cardiologists in the room knew who it was, sadly. One person that was greatly touched by Lester Morrison, though, was a very famous man, an engineer from Santa Barbara. Nathan Pritikin drove down in the early 50s from Santa Barbara, where he had a very vibrant aerospace engineering business and many patents and many contracts with the Air Force. Drove down to Dr. Morrison and said, check my cholesterol. I read about you in the Santa Barbara paper, because Dr. Morrison got some fame out of his studies. And Pritikin's cholesterol was well over 300. He was about 44, 43 years old. And Dr. Morrison said, go step on those stairs over there. That's how we did a stress test in the 50s. And pretty soon he flunked the stress test, even though he didn't know he had heart disease. Not a perfect way, but nonetheless. And Pritikin took that diet sheet and started studying and studying and studying, because he was a very bright, motivated guy. And pretty soon put together a program for him of eating whole food, plant-based, naturally low salt, oil, sugar diets, and moving and running, and ultimately, showed tremendous results in his own blood work, got his cholesterol down to 120. He did subsequently have stress tests that were always normal for the rest of his life. But he built the program in Santa Barbara, moved it to Santa Monica, and then after his death, it got moved now to Miami Beach, where it's in the Doral Country Club. But what was remarkable for a man who was an engineer is they actually put together a large program, kind of like Dr. McDougall. Come live with us for 3 weeks, let us feed you, let us help you walk. All you know, that's where Dr. Michael Greger's grandma went to on death's door, and showed even in papers that had thousands of subjects, cholesterol fell within a few weeks significantly, body weight fell, blood pressure fell, published this stuff in major medical journals, and it had an impact. And Pritikin was a dreamer. His famous quote was, all I'm trying to do is wipe out heart disease, diabetes, hypertension, obesity. So, big goals, and exactly the goals we should be teaching medical students and nursing students and physician assistant students and such. But they're rarely going to hear it, sadly, although all the data is there that you need. And lastly, I can't not mention Dr. Dean Ornish. Which one's Dr. Dean Ornish? Okay, you probably there. Anybody know who that is? Satchidananda, right, Satchidananda. Satchidananda, now passed on, very famous philosopher and guru of Indian origin, obviously. His books are amazing. He was very famous at the time. He opened Woodstock and gave the opening blessing before Santana came on stage and played for the next 8 hours as high as a kite. But they met when Ornish was a teenager. Dean's parents in Dallas, his father was a dentist, was very fond of Eastern traditions and philosophies, and it had a big impact. And when he was a medical student, you may know that he was actually both suffered some depression as a medical student and was looking for a solution, in which he found in nutrition. But he also took a year off of medical school to do an early study, knowing this data about Morrison and Pritikin. So what if we take heart patients and we feed them this pyramid of vegetables, fruits, beans, legumes, whole grains? We leave out, just like Morrison, oils and olives and avocados and nuts, and find out what this is going to do. And he did a preliminary study published in 1983, but this is the famous lifestyle heart trial published July 21, 1990. And this is such a profoundly interesting study for a disease previously thought to never be reversible. Because not even Pritikin could show that heart disease was reversible. He could show cholesterol came down, blood pressure came down, diabetes, body weight came down, but not heart disease itself, because that takes very sophisticated technology. Now this has special interest to me because I began my cardiology career July 1, 1990, and in 1990 you didn't get your journals on the internet. You got your journals in the mailbox, and I subscribed to this journal. It's a prominent journal called The Lancet, and my mailbox became, I was reading on my sofa and just flipping through, and here's this article I didn't know. Nobody knew who Dr. Ornish was at the time, but the co-authors were very famous scientists and radiologists and cardiologists, and plus this is a very prominent journal. So about 3 weeks into my career, I realized I now have 2 ways to reverse heart disease. One's called a balloon and soon after a stent. And the second way was to teach patients the diet that we were already eating, but not realizing had heart protective abilities to the degree that it does. In 1998, Ornish published the full trial with 5-year follow-up, and this data point in that paper was presented. This should have changed cardiology forever. What this is the fact that he was able to convince a number of patients to get a heart catheterization at the beginning of the study, come back in a year, even if you feel good, have another heart catheterization, come back 5 years after the beginning, have your final heart catheterization, have a computer in Houston analyze all this data, even though these patients were largely in San Francisco, because the best lab in the world was Dr. Lance Gould in Houston. And what he found was that the group in the black circles were told, follow the American Heart Association diet, you have heart disease. Both groups had an average amount of blockage in all the arteries combined by a mathematical equation of about 41%. The black circles followed the American Heart Association diet, kaboom, worse, more and more blockage. And Dr. Ornish had put the other group on this whole food, plant-based diet, along with exercise, along with yoga, along with meditation, advise them not to smoke, and for the first time ever, using the most advanced technology in cardiology, showed you can start to clean out your arteries without a balloon, without a stent, without a rotor. So this should have been, in the blood and in the very, breath of every cardiologist, that they had a tool called lifestyle that could actually reverse the #1 killer of men and women in America. Game over. Should have changed everything. We shouldn't have been talking about bypass and stents. Should have been talking about lifestyle centers. Well, unfortunately, and follow the money would be a lot of it. You can claim his numbers weren't all that big, could be part of it, and other factors. It didn't quite happen that way for most cardiologists, and if you went around and polled most cardiologists, most would not know who Dr. Ornish was. Very few would know who Dr. Esselstyn was, unfortunately. However, what you got to give both the Pritikin family credit for and the authors, and Dr. Ornish particularly, is although that study was 1990 and 1998, it took all the way down here, 2010. They finally, both places, the Ornish and the Pritikin programs, had so much published data, now with 3,000 patients in one publication, 4,000 in another, that our government approved for payment. That's the whole key. Once you get governmental approval for payment, you have a chance of spreading the word. Both of these programs, if you've had a heart attack recently, a stent recently, a bypass recently, a heart transplant recently, if you're having angina chest pain, and if it's somewhere around you in your community, there might be an Ornish, it's called intensive cardiac rehab, or Pritikin intensive cardiac rehab. Your insurance company will pay for you to learn how to make a green smoothie and breathe some yoga breathing and manage some stress. Unfortunately, these programs are all over the United States, but there's not enough of them. In the state of Michigan, we have one. We have the Pritikin program in Ann Arbor, Michigan, that's it. All the hospitals I work at have no interest in doing this because this is preventive medicine. Preventive medicine prevents procedures. If you prevent procedures, you lose income. It's a horrible thing. I don't know if there's one in Hawaii. There is one in Los Angeles. There's a program in San Francisco, of course, where Dr. Ornish is centered. It actually produces more income for hospitals to do this. So if anybody's on a hospital board or wants to talk to your hospital executive, tell them that this exists, because it's just a matter of sending some people and getting them trained. I am going to skip a little bit of the additional Ornish data. Esselstyn, what can you say? I mean, an absolute American hero. I would imagine most people in the room know of him, but just to be fair, a Cleveland Clinic surgeon, not a cardiologist, and not even a heart surgeon. He's a breast and thyroid surgeon who in 1985 got very interested in heart disease because he shared a locker with a cardiac surgeon and their shoes were touching and they talked for a year. It's a true story. That's where it all started. And he spoke to the cardiologist at the Cleveland Clinic. When you come across patients that are not candidates for angioplasty, stents, bypass, why don't you send them to Ann and I and his wife, and we're going to work with them and try and, coax them into a better lifestyle and see what happens. He had no funding, essentially. He was doing this late at night and on weekends. He had an active practice. And lo and behold, he developed a diet of grains and legumes, lentils, healthy stuff without all the same, very much like a Morrison eating list. Naturally low in fat with whole plant foods. The classic picture you've probably seen of a badly blocked heart artery, dramatically better a few years later. Now, Dr. Esselstyn didn't have this prospective, everybody gets a repeat cath. So there's a few examples. Here's another one, a badly blocked right coronary artery that's much better 5 years later from nutritional cardiology, nutritional reversal. But he did keep very careful records and published papers. The reason his program is not paid for by the government or other insurance programs, Medicare, Aetna, Blue Cross, Kaiser, is the numbers just aren't big enough and they really require massive numbers, good or bad. In my own practice in suburban Detroit, I know that this stuff works, that the Ornish and the Esselstyn and even Dr. Joel Furman has some data like this. I use those ultrasound scans, and this is somebody who underwent a year apart, the carotid ultrasound, and blockages that were very big, a 4.9 millimeter blockage is down to 1.5 millimeters. And a 2.3 millimeter blockage now has shrunk down to 1.1, on and on. I see all the time plaque going away. It really happens. I don't know how many other cardiologists in the United States right now can say they've got dozens and dozens and dozens and dozens of honey who shrunk the plaque patients, but it really does happen, and it really is something you can strive for. It may not be easy to change your diet, and I would add on the other lifestyle factors a la Dr. Ornish and do the whole thing, but it really is effective. So it isn't just that we're born clean and wonderful like the first slides I showed you, and we get clogged up and then we die, oh, what a happy life. We can actually go the other way, and even better, add in the healthy lifestyle and diet as early in life as you can, and you may never end up going down this pathway. I'm going to speed up a little. So, two kinds of cardiologists. There's our friend Dr. Kim Williams again, coming in 2 months. There's cardiologists who are vegans and those who simply haven't studied all this data, and it's true. Okay, this is, somebody was asking me, is there any new data that supports that we can treat people without bypass and stents? Now, my hand's going to go up and say whole food, plant-based diets. This was published in November. It's $100 million study of heart patients who traditionally would get bypass and stents, a little over 5,000 of them, very severely clogged patients having chest pain. They flunked their stress test, but they were enrolled to either get the bypass and the stent or to be treated with medication, diet, and exercise. But it wasn't a whole food plant-based trial. So I am stretching the truth here a little bit. I'm not even going to go there. Here, actually, I just want to show you one thing. The diet data was eat a low saturated fat diet. That's all they told them. Well, you know where saturated fat is. It's in cheese, it's in meat, excuse me, it's in whole dairy, whole milk. So they did instruct these people, and they gave them more information how to achieve a low saturated fat diet. 3.3 years later, whether you had bypass or whether you started to enjoy salads, there was no difference in your risk of dying, and in fact the risk of dying was low. The point of it is we have a very large study now that suggests we are doing too many bypasses and too many stents, and we're not doing enough of lifestyle and diet for people that need it. And so we need more programs like Ornish and more programs like Pritikin and more doctors, and frankly just getting people to read some books and watching some documentaries. I'm not going to go through all the data. This is one of our Michigan heroes, Marc Ramirez. He's obviously 1990 to 1994 had a career at the University of Michigan in football. What do athletes look like 10 years later? All too often, they're no longer in the gym 5 hours a day. He was told by his doctor, you have a high cholesterol, you have a high blood sugar, you're diabetic. Soon thereafter, he started having that manhood thing, erectile dysfunction, because of the blood sugar, the blood pressure, the blood cholesterol. He had all these little things you may know of, all the meds and such that he had to take. And after about 12 years of that, that's not even a fair picture, his in-laws said, you know, we just don't like what's happening to you. We like you. You're a good father to our grandkids. They gave him a copy of the famous movie. They gave him a copy of Dr. Bernard's first edition. He now has a second edition of this incredible book about reversing diabetes with whole food plant diets and naturally low in salt, oil, and sugar. And you saw a minute ago, I obviously put the slides in the wrong order. Marc Ramirez and so many other people have been able to either improve or eliminate their diabetic status, and everything else that was wrong with him is gone. He's on no medication for years and years now. I'll tell you why we have so many examples of that in Detroit in a minute. What are some of the problems with vegans? Junk food. How dangerous is junk vegan food, which is really a hot sector right now in the food industry, in the restaurant industry. They get it. People want plant-based food options, but they're providing them garbage. This is a study about 2 years ago from Harvard School of Public Health. There's something called their H, the healthy plant diet, and U, the unhealthy plant diet. It actually turns out when they looked at data, if you eat an unhealthy plant diet, you actually had a higher risk of dying of heart disease over a long period of follow-up, 30 years, than if you just ate a standard American diet. If your diet is Mountain Dew and Pringles and you're a proud vegan, it's not going to work well for you long term. And that clearly is a message we need to say over and over. I don't even like the word plant-based anymore. I have a book, my 5th book, which has been out about a year and a half, called Plant-Based Solution. I seriously wish I would have just named it the Plant Solution, because plant-based allows for Pringles and plant-based allows for, you know, frozen pizzas that just have some other kind of cheese in them than cow cheese. Unhealthy plant diets can be nutritionally unfavorable. So we have to eat apples and green leafies and squash and all the other foods you know of. The other problem that might exist, that's why I put a question mark, most of us know we probably should take B12 or at least get our levels checked. We have stores of B12 in our body, so if you started January 1, that was your first day being a whole food plant-based vegan eater, you're probably in okay shape, but you don't want to get in a situation where you're risking your brain health, your nerve health, and your blood health. Whether we need to take vitamin D, and there's a big controversy whether we need to take algae omega-3. I'm a fan of taking all of these, I do myself, but there is controversy. I'm going to spend about 5 minutes on some totally different topics, and then I'll take questions. because there's this word lifespan versus health span. Lifespan, how long we live. Health span, how many years of our life are really good quality and not, encumbered by medication procedures and chronic disease. That happens to be my mother's father, my maternal grandfather, who at age 89, swimming in a pool in Miami, had a stroke and died. So he was healthy to the last 10 minutes of his life. That would be something we'd all love to strive for, not the tragedy of that strange death, but the health span that was 99.99% of the years on the planet. So Harvard has given us a few steps how to extend our lifespan. We need to eat, this is data published about 3 weeks ago and about 3 years ago also. We need to eat a predominantly plant-based diet according to Harvard School of Public Health. You're so sweet. We have to exercise, it doesn't have to be vigorous. We can dance, we can garden, we can walk, we can go to the gym. We need to have no more than a glass of wine a day. Again, it shows up, but there it is. We need to try and keep our weight, even if you had a husky bar mitzvah suit, try and keep our weight down, and we can't smoke. If you do those 5 things, there we go. Haha, I'm funny today. And if you're a woman, it says female there. If you do all 5 of those things, you get 14 more years of life than if you do none of those 5 things. There's a lot of people that do none of them. If you're a man, you get 12 more years of life. It's always a little bit lopsided to guys. But so lifestyle matters a lot. And if you want to have a long life, you follow those 5 steps, a plant-based diet and the other things. But let's talk for a minute about what we call health span. Wouldn't you like to have your health all the way towards the very last day of your life? Rather than, if you look over here, the average American spends 5,000 of their 30,000 days on the planet in poor health. All kinds of medical problems. So 1/6 of their life is in poor health. Not a really ideal situation. One way that you may be able to achieve that I'm interested in, I think it fits in with many people that are eating plant-based. They're not all having the perfect blood pressure. They're not all having the perfect cholesterol, and they're not all having the perfect body weight. And they're frustrated that there's a message you can eat as abundantly as you want if it's whole foods and there's no added salt, oil, sugar, and you can eat as much as you want. I do not believe that. I think there's too much food on this planet for all of us, and even whole foods, which are much more favorable, called calorie density. There's way fewer calories per pound of green leafies than there are of meat and cheese. But anyways, we're still struggling with this. I've become a student, and it's such a hot topic now, about using fasting and the fact we have built-in mechanisms that when we stop eating or cut back our eating once in a while, we actually can repair our body and restore health that previously wasn't there. Whoa, this is a crazy slide. I just want to show you one thing. I can tell you all about this slide. But 25 years ago it was found if you took yeast, same yeast made to make beer, and you cut back how much sugar and animal-based amino acids, basically meat, you found that yeast lived 10 times longer than if they had the standard chow. And then it was found out that worked all the way up to mammals. We are a mammal. It turns out when we are exposed to less sugar and less animal-based amino acids, which are going to be found in meat and chicken and pork and such, we have the same pathways in yeast. That's rather humbling that the simple little brewer's yeast and us share fundamentally the same pathways. So certain scientists, like my very good friend at University of Southern California, Walter Longo, has been studying for years and years. What if once in a while we create a diet that's lower or very low in sugar and lower in the amino acids of meat and see what that does to our aging pathways? Now, if you're eating a whole food plant-based diet, you're doing this almost every day of the week anyways. I think that's something we haven't discussed much about why many people feel plant-based eaters have greater health. But it's through these pathways. Dr. Longo, for the rest of the world, created a diet that for 5 days you eat a little bit like a whole food plant-based eater. You have a diet that has very little sugar and the amino acids that are in meat are absent, so you actually can eat about 800 calories a day and get a response like you were eating nothing for 5 days. What he showed, and I'll just blitz through this in published papers, is that within just 5 days, people will lose body weight, but they will lower their inflammation. For many people in the general public, this is the first time they've gone 5 days without sugar and meat,